Hey guys, John Adamson, the Rehab and Documentation Guru. Sorry for the poor video quality, but I am driving home and it's late. Had a little date with the wife, but that's not what you're here for. You're here to hear about rehab-related issues. So today, I was wrapping up my day and then I got an urgent email. I had done a case opening on a patient in her 60s who had been involved in a motor vehicle accident, multiple fractures, lots of restrictions, and emotionally distraught on the initial evaluation on the case opening. And I spent a long time with her. I usually spend a good amount of time with my case openings anyway, because I realize I'm representing my whole company when I'm there. And I want that patient to come back to my company if they ever need home health again. So I know first impressions are important. I've witnessed openings by other clinicians, and I was not impressed. So I try to make a really good first impression. I mean, partly because I try to be thorough, for one thing, because I also know that I might be catching things that the doctor missed. And that's not cockiness, that's just fact, because I'm spending a lot more time with the patient. So anyway, I had this patient, did her case opening, but I was in another therapist area, so I turned her case over, first to an assistant, but the other therapist was going to be picking up case management. So today I'm wrapping up my day. It was an earlier day, which was wonderful because I had some errands and I was meeting my beloved for a date. And this patient apparently had called our office and complained. What was the nature of her complaint? She was complaining that the assistant had been coming, and this assistant is excellent, by the way, very good clinician. She was complaining that the assistant, though, was not giving her what I had promised. She claimed to my office that I had promised her 2 50-minute sessions or more time per week. So each session would be a minimum of 50 minutes. I have no idea where she got that from, because I never make such a promise to my patients. And here's my point for this video. I would encourage you to get in the habit of being very scripted in your discussion of the care plan. So for home health, I tell them, first of all, what I'm expecting for frequency. And then I tell them in general, especially if an assistant is coming, what they can probably expect for a visit time. And I'll tell them the basic minimum that Medicare recommends for a follow-up visit, which is 30 to 45 minutes. So I'll say you can expect your visits to be about 30 to 45 minutes, depending on your need for that given day. And I make that across the board for all my patients. Now we know there's going to be patients that are going to be closer to the 30-minute, and I've had visits like that. And then there's going to be longer ones. But I tell them this is about what you can expect. But I never would say 50 minutes. I don't know where she got that from. So anyway, this patient called, said I had promised that. This therapist assistant was not giving that. And so the current case manager asked me to call the patient as a follow-up. So I gave her a call. And right off the bat, she was very cold on the phone. And I said, I understand you called the office and you had a complaint regarding the visit time. And I said I wanted to clarify what I said at the beginning. And she was very, very belligerent. And she said, I know what you said. I'm blank years old, and I'm not losing my mind. And I wrote it down, and you had said this. And I said, ma'am, I never say that. I have a very specific thing I tell all my patients. No, I'm not a liar. Have a good day. Goodbye. Click. So my I could tell my blood pressure and heart rate were up after that call. I I take I take it pretty personally when people call me a liar, for one thing, because I value being honest. And so anyway, I that's what happened. But my point for making this video is be consistent about what you tell your patients. In home health, I've had situations where one of my home health patients happens to know that I started the case on another home health patient. And I'll go to that patient, they'll go, by the way, are you seeing so-and-so? And I would have to say, and I always say this, I can't tell you who I am seeing because that would be a violation of HIPAA. I said, however, if you have knowledge from a patient who's told you that John from blank agency is coming, then you guys can talk about that amongst yourselves. And they understand that, and they respect that. But suppose I had told patient A one expectation of visits, and I told patient B another. And then the one patient said, well, John told me he'd be here for 45 to 60 minutes for his visits in general. And then the other one said, well, that's weird because he only told me 30 to 45 for mine. Or, so if I'm setting different expectations for different patients, there's a possibility it'll come back to bite me at some point. So I try to be rather obtuse. I'm not very specific. And I try to make sure that I give myself leeway to say it can depend. Some visits you're going to need me more, some visits you're not going to need me as much, and it just depends on you. And just leave it at that. Because patients do compare notes, and sometimes it can come back to haunt you. The other thing is, I could honestly call that patient today, who I did the case opening 22 days ago. Do you think I remember all the things I told her that day? I remember the gist because, one, I could tell she had psych issues. She had lost her husband earlier in the year, and then she lost a close family member after that. And then she was in this massive motor vehicle accident. She can't work. So, she had that on top of what appears to be some other emotional issues. But I remember those things, but if I keep things scripted and I say the same thing to every patient, I could call her today, 22 days later, and say, I didn't tell you that. Of course, not that she could sue me and this would hold up in a court of law. I didn't document the visit expectation. Looking back, would have been a good idea. Well, if you have a psychiatric patient, maybe it is a good idea. I don't know. But that's not usually something I document. But I told the patient, their typical visit time would be 30 to 45 minutes. But if I keep things the same, I know I can tell them with confidence, even a year later, this is what I tell all my patients. And so I just encourage you to be kind of scripted about that. Anyway, it's John Adamson, the rehab and documentation guru. Guruing? Is that a word? Anyway, hope you have a great night. Take care. God bless.